It's hard to find hope when you're sick and homeless. Imagine the fear of a mother escaping domestic violence who can't provide health care for herself or her children. Or the despair of a man without a job, too ill to work. The Orange Blossom Family Health Center, a caring service of the Health Care Center for the Homeless, is making our community a healthier place by helping the homeless return to self-sufficiency and providing a safety net for the medically uninsured.
We have a place that individuals can go to receive timely, quality healthcare services. And what that means to the community is that we don't have individuals unnecessarily utilizing the emergency department.
It all began 2 decades ago when Dr. Rick Baxley brought together a group of providers and began volunteering to improve the health of people being served through a local homeless shelter.
We saw 6 patients that first week, and then now we're seeing over 8,000 patients.
Upwards of 10,000 people will experience homelessness in Central Florida in the coming year. Many face chronic health issues such as high blood pressure, diabetes, and cancer. Issues that have been aggravated by a lack of access to care. Many have not seen a health care provider for years.
And as a result, when they come to our doors, their care, in some cases, has been very fragmented. They've been in and out of emergency rooms, and so we're kind of there to kind of piece things together.
By providing multiple services in one location, the Orange Blossom Family Health Center has created a medical home for our patients.
Primary care is the anchor program of our center here because of what we do in terms of education, prevention, and disease management.
While some of our homeless patients come from local shelters, many live on the streets, in the woods, or in their cars. The center also reaches out to homeless individuals through our 2 mobile medical units, Clinics on Wheels.
Hi, welcome to the mobile unit. My name is Dolores, and how can I care for you today?
I wanted to get my blood pressure checked and talk to the doctor.
Each staffed by an advanced registered nurse practitioner and 2 medical assistants. Florida ranks among the top in the United States for cases of infectious tuberculosis. The Health Care Center is addressing the problem among the homeless.
Our residential TB shelter is unique in that it provides a refuge for patients who don't have anywhere to go when they get discharged from the hospital.
The Health Care Center for the Homeless takes a holistic approach to medical treatment, caring for the whole patient through a multidisciplinary approach.
That's a little better like that?
That's much better.
Okay.
This multidisciplinary approach includes vision services, often for diabetic and hypertensive patients. Our mammogram services benefit female patients age 40 and over, some of whom have never had a mammogram. Our on-site pharmacy ensures access to prescribed medications for our patients.
So the quicker you do the application for the patient assistance program, the better it would be.
Those who qualify are able to obtain medications free of charge from major pharmaceutical companies through the Patient Assistance Program. Of the estimated 10,000 homeless people in Central Florida, many are suffering from mental health issues. Addressing this need is an important part of caring for the whole patient.
The behavioral health department is an amazing part of the entire medical clinic. Not everybody needs mental health services, but when they do, it's life-changing.
The health center has changed my life by giving me respect. I needed a lot of care, not only psychological, but I needed my dental fixed, and the dental team is excellent.
Let me see that pretty smile.
Here in Central Florida, with its dominant hospitality industry, a healthy smile is nearly a precondition for getting a job.
Very important to be able to provide replacements teeth for people that have suffered a lot of tooth loss.
Adults and children have access to cleanings, fillings, and extractions. And the clinic provides partial and complete dentures for patients who have lost their teeth. Our mobile dental unit is also taking these services out into the community.
Anybody home?
Because those who need help don't always seek it out, we employ aggressive street outreach.
We log about 120, 130 miles a day. We're all over Orange
Our
County
HOPE team, or Homeless Outreach Partnership Effort, is our connection to those who live on the streets and in local wooded areas.
When's the last time you went to a doctor?
Long time ago.
Okay. How do you feel about us taking you into the clinic?
Our main goal is to establish a rapport with our clients, build a relationship with them so that they can allow us to help them, bring them in for medical services.
Robert has lived in the woods for the past 2 years.
I got a spider bite on my leg. I went to the emergency room twice. I burned a fever for 2 weeks. I was really sick, and I was pretty much laying back here dehydrating and dying.
All right, gonna pull.
I called Nancy, and she came out here, and they've been out here 2-3 times a week since then, making sure, taking me to the doctors and making sure my dressing stays clean and pretty much taking care of me.
Looks good, kiddo, it's healing.
Thank you.
To find people out in the woods, we make a concerted effort to, when we're driving along the streets, to look where there's been an area or a patch of grass that may have been walked upon, follow those trails, because to us, it's one more person that we can help.
They found me when I was living in the woods. And at that time, I had really no real hope, of getting out of the woods.
The Orange Blossom Family Health Center relies on many sources to fund the vital services provided, including federal, state, and local grants. And while these are generous resources, they don't cover the total cost of our programs.
We need financial support from the public so we can fill that void that's not met from the federal grants that we receive. So we want to ensure that the community knows that once you make that investment into the Healthcare Center for the Homeless, those funds will be used for the purpose that they were given.
Your donations make a world of difference in the lives of the people we serve.
Your contributions made it possible for us to begin this mission and bring it to the place of healing it is today. Please help us keep it going. The need for the center and your support is greater now than ever. Your dollars really do change lives.
Your support will provide health services to people who have no other way of getting the care they so desperately need.
I feel that, there was nobody cared for me, and I feel a little better now.
The Healthcare Center is my friend, definitely.
It's a gift of God. It's not a gift of the world, it's a gift of God.
They've been good to me.